Okay, good afternoon once again, everyone. I believe we have the majority of our registrants that have registered for this afternoon's webinar, so we'll get our program underway now. And at this time, I will just provide you a screen share of our program this afternoon, just to give you a high-level overview. We'll begin with a call to order and opening prayer. We have our chairperson of the Council of Elders, Nisga'a, with us this afternoon. And then we'll call on Madam President Eva Clayton to provide some opening remarks. And then we'll go to our medical health professionals, the lead in our response to COVID-19 in the Nass Valley and the Nisga'a Nation, our NVHA CEO Brandi Davis and Dr. Jeremy Penner. And then Dr. Penner and Sadid will provide us an update on COVID-19 testing and terminology of just so that we're all clear on definitions in relation to that. And then we'll hear from NLG's Emergency Response Services Manager, Mr. Anthony Moore, who will give an update on the Nisga'a Emergency Preparedness Committee's transition between phases in response to COVID-19 in the Nass Valley. And we will then go into a question and answer period, followed by a closing prayer. So just so we are aware, as you'll see at the bottom of your screen, there's a Q&A button there where you will have an opportunity to provide any questions you have in relation to the topics discussed in the webinar today. And I briefed the panelists that if there is, each of them have an opportunity to type an answer in response to your questions so that we can maximize our time and try to attempt to answer all of the questions. We won't have time to get to all of them verbally, but I've encouraged each of the panelists to monitor the Q&A box to provide written responses as well. So with that, Nisga'a, if you would start us in our traditional manner of an opening prayer. I've elevated you to a panelist, so if you could just unmute your microphone.
Can you hear me?
Yes, you're a little quiet, but we can hear you. Oh, you're back on mute now.
Okay, here I go. We خرج from the board قبل جهة إشكالنا شلون مسنين من البداية أكتب هوجي تبجاك تمشي يكتب هوجي خم في أشعار تمكن الماك تجابه يا تموي تبجاك تمكن تسيب تموي بس لخوش لكتبان جيدا من وي تموي there. Is you shared?
Well, OX means Margaret. So with that, I would now like to welcome Madam President Eva Clayton, who will provide us with opening remarks.
Thank you, Bobby. Good afternoon to members involved in the webinar. Today, we will hear an update from our medical professionals, as well as our Emergency Preparedness Committee on the state of COVID-19 in the Nass Valley. We are in very unsettling times, but I would like to encourage each of you wherever you reside, to continue to be safe, to stay safe, and to practice all of the safety protocols that have been issued by the provincial government as well as our Emergency Preparedness Committee. Our medical health professionals will also provide us with information on the definition of self-isolation, mandatory self-isolation, as well as quarantine. I think it's important that we all understand the terminology related to COVID. We are at risk if we do not continue to practice the safety code of protocols, and we must always be vigilant in making sure that we are all safe. We all have a part to play in the keeping our bubble safe. And I think it's important to note that this means practicing the safety guidelines at all times. It also means engaging in the social distancing, avoiding public spaces, washing our hands, and keeping the our gatherings to a very minimum because of the concern of COVID. As you will hear, and you no doubt have heard by now, that the BC is taking this very seriously and has issued restrictions. And it is the, I want to thank the Emergency Preparedness Committee, our medical health professionals, and all of the stakeholders on that committee for all of the work that they have done, the measures they have taken to continue to protect the safety of the our Nisga'a citizens on the homelands. In closing, I want to express to you once again that the Nisga'a Nation, Nisga'a government, is taking this very serious. And I want you to continue to be vigilant in staying safe. Continue to practice the safety protocols because we are in this together. Be safe, stay safe, take care. Thank you.
Madam President, thank you for those very reminding and helpful comments. And just in that regard, an additional point of housekeeping further to the Q&A is that out of respect and privacy of all involved, we ask that no questions be case specific or reveal anyone's identity or anything in that matter. So once again, I thank you all in advance for that due respect and common courtesy. With that, I would now hand it over to our medical team, starting with our CEO, Brandi Davis, and then Dr. Jeremy Pinner.
Thank you, Bobby, and I thank everybody else on the panel and all those who are involved this afternoon. Please be advised that Nisga'a Valley Health Board has received laboratory confirmation from Northern Health Authority of 9 positive COVID-19 cases. They've either originated or been through the Nass Valley. NVHA is working closely with our partners, the Nisga'a Government, EPC, Northern Health Authority, and First Nations Health Authority, ensuring we are all working together to protect our community members. We are meeting regularly and providing collaborative updates to ensure all those involved are aware and working through this together. During these uncertain times, it is essential that we come together as a nation to support and care for each other. The COVID-19 virus does not discriminate, and all members are at risk for transmission. However, please remember that the risk is greatly increased for our most vulnerable in the communities, our elders, our infants, and those that are immunocompromised with chronic disease, cancer, or other health issues. Taking the lead from the Nisga'a, that shows that every being has a rightful and meaningful place in society and that we are all independent. We need each other. Together, we will get through this. Thank you.
Thank you, Brandi. Dr. Penner?
Thanks. So I just want to start by giving an update on the COVID situation. And I want to start with just looking at what's happening in British Columbia. And it's also a reflection of what's happening in all of Canada. But there are two graphs here. This graph on the left shows the number of new cases each day in British Columbia. And this one on the right is just in the Northern Health region. And this is back March, April, May. So remember when the epidemic was just starting and we were having our first wave. And sort of the worst days at that time, you can see 80, 90 new cases per day in British Columbia. And everyone was pretty worried at that time. In Northern Health, sort of the worst day we had was about 5 new cases within one day, or 5 people getting a positive result. And then I want to fast forward here. So that was April, May, and then you can see in June, we had a bit of a break. July, we started to see a new wave, and then August and September, remember that's when we had a few people testing positive with COVID in the Valley. And it looked like we had this big second wave. But then look at where we are now. So September, August, November. So this is where we are now in BC, 700 new people testing positive per day. You can see this first wave that we were so worried about before is barely even a bump now when we put it in perspective with what's currently happening. And then the same thing in the northern region. So you can see that we had that break in June, and then August, September started to have an increase. And then this is where we are now. So on Saturday or Sunday, 35 new people tested positive. Over the weekend in total, about 50 new people tested positive in the northern region. But it's just showing that these new positive results in the Valley, it's what's happening everywhere. And it also explains how we're getting people, how people are getting COVID in the Valley, because all of our neighbors, Terrace, Kitimat, Prince Rupert, Prince George, it's happening everywhere. These cases are going up a lot. And it means that any time that we're outside of the Valley, we're definitely at risk because this is what's happening. So I'll pull those off. So overall, within the Valley, we've tested about 600 people since March, April, since we've started testing. We have increased testing capacity a lot over the past several months. So over 600 people have tested. We did have a few positive cases in August, September, as you know, and then since last week, as Brandi mentioned, another 9 people have tested positive. So that's really what this meeting is about, is another 9 people tested positive, either are tested in the Valley or passing through the Valley. So the response for that for Nisga'a Valley Health Authority is now contacting everyone who's tested positive, identifying who they've been in close contact with, and then making sure that they get tested as well. And right now we have testing available every day from 2 to 4 in every village. So all the health centers from 2 p.m. to 4 p.m. are doing COVID tests. We want you to phone first, just so that the nurses are aware that you're coming. Then they can get things ready. And we do have a COVID hotline that's been activated again from 9 to 5. The number, maybe someone can type it into the chat or Q&A, but the number is 250-633-5048. That's 250-633-5048. So we're testing 2 p.m. to 4 p.m. every day until further notice. It'll go all of this week and over the coming weekend. And the priority is anyone with symptoms. So as you probably know, the symptoms of COVID are similar to just a regular cold or flu. And they can be quite mild, but I'll just go through the list of things. So having a fever, chills, cough, trouble breathing, sore throat, trouble swallowing, a runny nose or a stuffed nose, loss of your sense of smell or loss of sense of taste, headache, muscle aches, being more tired than usual, loss of appetite. So if you have any of those symptoms, even if they're mild, we do want you to come in and get a test done. In addition to that, the public health team, either from Nisga'a Valley Health Authority or Northern Health, may be contacting individuals. So if we've found out that you were in close contact with someone who was positive, we may phone you and just say that you've possibly been exposed to COVID, and we may call you in for a test as well. And for those people, even if they don't have symptoms, we may request that you come in for a test. But for everyone else, it's if you've had any symptoms at all, we want you to come for a test. So now I'll hand over to Sadid to talk about some of the terminology that Madam President mentioned, and about the process him and the public health team are going through for contact tracing and testing.
Good afternoon, everyone. Just thought some of these terminologies, they sound similar. So if we could have them defined for everyone's clarity. We'll start with the quarantine itself. So in general, quarantine, or also known as self-isolation, means that a contact stays in their home and does not go out and avoids physical contact with all others, and practices physical distancing within the home as well. These are generally for positive cases. For we would recommend someone who has developed new symptoms and we're waiting for their results up until we receive that. And otherwise, active daily monitoring is something we would do for primary contacts. That would be a daily phone call with an identified individual for symptoms monitoring, to perform a health check for any new symptoms or progression of existing symptoms. And the information for isolating in the new home or co-living settings can be provided during that phone call as well. You know, it's basically a health check to make sure where these individuals are in terms of health and in terms of supports. Self-monitoring is checking with yourself for any new flu-like symptoms, the ones that Dr. Penner just mentioned, or progress of any current symptoms. So if you have a cold, if you have a runny nose, is it getting worse? Is it the same? Has it changed? And self-isolation, that is the same as quarantine. To stay home, to not go out, avoid contact with others, and physical distance within the home, including the use of separate room, dishes, toiletries, and so on. And again, when you have trouble with this, which is something that you know, is understandable, sometimes it's not feasible, then those conversations, those phone calls, those active daily monitoring calls and health checks are a good time to share that information and to see what can be done. Social distancing, maintaining a distance of 2 meters or 6 feet from others when outside the home, wearing a mask and performing hand hygiene frequently, especially after contact with surfaces outside the home. Social distancing is a recommendation provided to all to decrease the risk of COVID-19 transmission during this pandemic. So the social distancing is what we are, you know, we should be doing anyways. The self-monitoring is also something to do in general daily, just to make sure, you know, and if you develop new symptoms in general, also the recommendation is to call in, have a conversation with your clinic nurse, and maybe get a COVID swab. Essential workers. So another question's been, who is an essential worker? And generally that we leave to your employer's policy and how they define an essential worker. Primary contact. So in this case, primary contact means you are contacted by myself or public health in general based on being exposed to a positive case. More than 15 minutes in the same room or came within 2 meters of a positive case. Each identified primary contact is contacted and booked for COVID testing at their local health center, asked to isolate for 14 days, and that we will check on their health and symptoms daily for this period of time. That health check being the active daily monitoring.
So then I just wanted to touch on prevention, just because as I showed at the beginning, you know, COVID right now is everywhere in Canada. It's in the Valley. It's also all of our neighbors, all the towns and cities around us. So one thing to point out is just people who are returning from out of the Valley. I believe the Nisga'a government is still recommending 14 days of quarantine, even for people who don't have symptoms. So because of the number of people who have COVID in Terrace, Prince George, other areas, just being in those environments means that you could have been exposed. And there's the incubation period of COVID. That's the period where it can be replicating inside of our body before we have any symptoms. And that's about 14 days. So you can feel totally fine. You could have been in Vancouver a week or two ago, feel totally fine. But you could still have COVID, and you can start transmitting it even before you have symptoms. So having that 14 days from returning upon home. For people who do have symptoms, then definitely call the health center and get a swab done. But even while you're waiting for the test, and even if the test is negative, we still want you to self-isolate for 10 days from when you had symptoms, because sometimes the tests are what we call a false negative. So maybe I truly do have COVID, but the test says I don't, because the tests aren't perfect. So when anyone has symptoms, we have to assume that they have COVID. And then there's an infectious period. So from the time that you develop symptoms, we can be infectious for about 10 days, sometimes longer, but generally people are starting to get better and aren't infectious beyond then. And then the other preventive measures are really what Madam President outlined at the beginning. So We need to keep our distance when we can. So that's staying at least 2 meters apart from people who aren't within your household. So household members, we know you're going to be in close contact, but when you're around people who don't live with you, then try and keep your distance. And also just keeping to ourselves more. So not having the large gatherings, not visiting people as much. We still want social contact, but it'll have to be telephone and FaceTime and WhatsApp and those types of things. And then hand hygiene, so washing your hands frequently, definitely before touching your face, or using hand sanitizers. And particularly when you're going out, if you're going shopping, going to terrace, then really anytime you've touched something, then use hand sanitizer. And then masks. So really at this point, everyone should have their own mask kind of hanging by the door. So when you leave the house, you know, we should just remember to bring a mask with us. For in the valley, if you're indoors with anyone who's not from your household, whether it's at their house or whether someone's coming to visit you, really everyone should be wearing a mask in those situations. If you go to terrace or another city, then wearing a mask in any public place, whether it's indoors or outdoors, just because you're so much more likely to be in close proximity to other people. In the valley, I don't think that's really necessary because there's still lots of space. You're not necessarily going to be bumping into people when you're outside. And then hand hygiene before you touch your mask. So before you put it on, before you take it off, use hand sanitizer or wash your hands. The last point is just, you know, being outdoors is also good for our health. So when we say self-isolation and quarantine in the city, that may mean that you have to stay in your house because you can't leave the house without being in contact with other people. But you know, one of the blessings of being in the valley is there's a lot of places you can go outside without being in close contact with other people. And it's certainly good for our physical health, good for our mental health. So don't take it to mean that you have to stay inside your room or inside your house. If you can safely go out without being in close contact with other people, then try and do that as much as you can. And that was it from me.
Okay, excellent. Thank you to our Nisga'a Valley Health representatives, Brandi, Dr. Penner, and Sadid. Very excellent and useful information. So thank you for providing that. And there also, you'll notice in the question and answer box, there's a series of questions there. So if you wouldn't mind tackling those, if you're able to. Now, there's been a coordinated response since March with respect to COVID-19 and the development of a Nisga'a Nation restart plan that guides us through various phases in respect of our response to COVID-19 and the measures we take, the preventive measures we take to stop spread. So our Emergency Response Services Manager, Mr. Anthony Moore, is going to give us a description of the phases and how the decision was arrived at that we would revert back to phase one. So Anthony, welcome this afternoon.
Good afternoon, everybody. So the following update is how the Emergency Preparedness Committee is moving from phase 2 of the Nisga'a Nation Strategic Restart Plan and reverting back to phase 1 and how this will affect each Nisga'a citizen. So Nisga'a government and Nisga'a village governments are implementing these measures quickly to keep our elders, our youth, and our vulnerable populations safe from this high risk time. We believe that these actions are in the best interest of everyone living on Nisga'a lands. And as long as we get compliance from everyone involved, we can keep the spread to a minimum. So as you've already heard from our healthcare professionals, the mandatory 14-day quarantine for all those that have tested positive for COVID-19 and all those that have been in direct contact with those that have tested positive. For those that are in the quarantine state, there are supports available. So you would contact your village government to acquire any supports necessary. And we also have a food share program that's also available to provide assistance whenever possible. Regarding masks, it's mandatory in all public areas, offices, and facilities. So if you're coming into any of our buildings, village government, any of the stores, all these places, you are required to wear a mask. In addition to that, all social gatherings within the Nass Valley are canceled. Any type of gathering that is planned to occur. And that is not just for our rec centers. It's also for private residents and vacation accommodations. So no person may have present at their private residence or vacation accommodation, either inside or outside, a person who does not reside with them. The only exception would be if you may have up to 2 people present at the residence, if the persons are or individuals are visiting that resident regularly. For example, people who are taking care or visiting elders and making sure that they are all that their needs are met. But all the COVID requirements are still in place for that. So indoor and outdoor events, as defined in the notice that we sent out on November 5th, are prohibited now. This includes religious, cultural, and community events, with the exception of limited events that would be brought forward to the Emergency Preparedness Committee. These may proceed with up to 10 people, including the officiant, provided a COVID-19 plan is in place. These are guidelines and restrictions and health orders that the province has set out and are being followed by Nisga'a government. We've also had a few questions regarding fines. So we have people who may not be compliant, and we're looking into different avenues of being able to find people who are not in compliance with any health orders or orders from the Emergency Preparedness Committee. And we're very close to being able to issue fines that would, but there's a lot of more work that needs to be involved with that. With regards to essential workers, we are compiling a list in working with each of the village governments, with the buildings, businesses and whatnot within each village, and defining what an essential worker is. And this falls right into the supports for the school district. So the school district has reduced operations to having children go to homeschool. This is only a temporary action, as the importance of continuity and learning for students is a priority for the Emergency Preparedness Committee and the school district. but it is necessary while we are in phase 1 of the Nisga'a Strategic Restart Plan. Once we are past this current situation, the EPC will work diligently towards getting the students back to face-to-face instruction once it is safe to do so, on the advice from our health authorities as well as the Emergency Preparedness Committee. I'd also like to touch on reports from our local RCMP detachment. We've had reports of social gatherings that have occurred within within homes, especially over the weekend, and they're putting themselves at risk by responding to certain types of calls. And with guidance from the RCMP, that they are requesting that everybody follow these guidelines of no gatherings or events in public homes and inside or outside. If they are in a position where they're compromised and they're no longer able to render assistance, the level of service will drastically drop from what our RCMP is already capable of. I've already touched on supports from village governments, but also like to stress that if you are in isolation, we do have supports from Salvation Army as well. I'm just trying to make sure I catch everything here. So these are a few of the things that the committee has been diligently working towards, and having regular meetings over the last few weeks, and essentially meeting every week since the start of this pandemic back in March, and more meetings when required, such as our current status. So yeah, that's a bulk of the information provided for the Emergency Preparedness Committee, and I'll continue to work on any questions that are fielded in the question and answer section.
Okay, thank you for that, Anthony. And I see they're rolling in steadily, so we'll give you some time to tackle those.
Bobby, can you hear me?
Yep.
I have a statement to make in Somalia sometime, if it's possible.
Yes, now would be perfect, Herb. Thank you.
Simgiyat, Sigramana, Tkowilchik, and Hanik Skovkil. Kijabam Nism, Toyaxim Nism, Wilmasim Gun Sam Twilkum, as Kagari Masars Gun. Castle, the Kustabiet, the Cheats, Candidates. So, Teat Nidit, and Kunga the Togach, as well as the Eric Candidates. Canwilt. That ni wayam that agamasi yet, but lachanizok. The looks low, them the cooks amagat, the cat come. Up to walk, candidates law. The piasm to which could yukt, kilmo, chawat kudayo. Yukt kaxiak, can look at kumkot. Hagun still a sheep gun. The sim get a mox nesum. A step nedit and was to mola gul akku. As can look at come got, the wish could a sheep gun. Tim Jahoudnum, those comanax. Tim came got. Can out him got to Mulu, Dum gan yes geks gan siebens skapte doexemplism as I am godsam. I just wanted to share in English the main parts of this particular message. This sickness that has been in the world for some time now has reached us. And it is incumbent on us, it is time for us to take good care of ourselves. We might lose lives. You all see what this illness brings as we listen to the news of what it has brought to those, the sorrow, the difficulties they go through. We should stop our partying on weekends. Instead, let us be in compassion and comfort as we go through this particular difficult time. That way, peace and love will be alive amongst us. We should listen very carefully to the messages and the recommendations of those who are trying to guide us through this difficult time, because it brings sorrow and it hurts. Thank you.
Thank you for those very kind and compassionate words, and a strong reminder for us to remain vigilant, to look after ourselves, and to be kind and respectful with one another, especially during these unsettling times. So that concludes our relatively short agenda. The primary focus today was for to hear from our leadership, and also to hear the medical information and facts from our medical professionals. I think they provided a very excellent overview to the questions that have been posed, and that will, I'm sure, continue to come forward. So as you heard from Anthony, the Emergency Preparedness Committee, which is comprised of NVHA, School District, NLG, and each of the 4 villages, and RCMP are working together collaboratively to implement the necessary actions and resources to ensure that we are acting in a unified manner to keep this sickness at bay. So with that, I think I'll allow for any of our Nisga'a Valley Health team, if they'd like to provide any closing comments at this time.
I do just want to assure the community members and the Nisga'a Nation that we are taking this seriously. It may seem that we're overreacting, but and we don't want to strike fear in community members' hearts, but we do need to be aware that this the COVID virus is around and it's serious, and we need to work together to protect each other and to protect the most vulnerable of the nation. Thank you for taking the time to be with us this afternoon, and I just pray for health and wellness for all those that are attending.
Thank you, Brandi. Dr. Penner, Sadid.
I'll just mention, because there were at least some questions about the school and safety in schools, and I didn't get a chance to type a response. It is something that we're monitoring on a daily basis. So in general, children who do get infected with COVID, it's almost always getting infected from home. So it's usually risks of other people in the households, and that's how they get it. There's very few transmissions that actually do occur in schools, although it does happen. And so it's a balance between the consequences of closing schools and keeping children at home, because that also has consequences, and balancing it with these small risks of the schools being open. So every time we do identify someone who is tested positive, and we go through all of their contacts, if we do see someone who's positive and a transmission has occurred at school, then there are steps that we work with the school to put in place. And it may be that an entire class is contacted for testing, or a class is actually shut down temporarily. It's unusual to have to close an entire school. But just to reassure people that we are aware that there are concerns, and we are reviewing the situation every single day.
Thanks, Dr. Penner. Sadid, did you have any closing remarks?
In closing, I would think of each individual in the community as a partner in this, and that one person can't win, if there is such a thing. It has to be done as a collective. We all are in it together, and in a large way, we are helping protect each other. I think wearing a mask is that symbol, because you are protecting others when you wear a mask, and it's the same kind of attitude towards COVID in general. Thank you.
Great. Thank you once again to each of you for your time this afternoon, and for providing us with that critical information. Anthony, did you have any closing remarks at this time?
Yes, yeah, thank you. So thank you all for being able to take the time out of your day and hear the current status of everything that's going on. I hope everything that we've been able to provide you answers a lot of the questions, and we will work towards answering the questions that have been posed on the question and answer thing. I also just like to reiterate that those that have tested positive, and those that are on social media, we need to cease all of the negative reactions, all of the responses that could hurt the person that who may have let their name be public. We need to show support for these people so they can get through these times. At any point in the future, one of us may be also in that same situation, and I wouldn't want to be. I'd want to be transparent if that was the case, but at the same time, I might even be hesitant if all I'd be getting was negative reactions for trying to be transparent about everything. I know the transportation between communities and going to terrace and having to isolate is going to be difficult, but we feel like it's been said before, a necessary action for the time being to make sure that we don't spread the virus. we want to ensure that we keep everybody protected here. With the limited resources that we already have, whether it's our healthcare system, our emergency transport system, even going as far as our RCMP, we are already stretched thin as it is. And we want to make sure that our resources are there, ready to provide assistance when necessary, but at the same time, we all need to do our part in achieving that goal. So staying home whenever possible. There is a few that are essential workers and that have to go to work for the type of job that they have. There is a lot of jobs out there that are not able to be done at home. O&M workers, as an example, they can't work from home. They're out there ensuring that the roads are plowed, the water is still going to your homes and things like that. So just as one example of an essential worker, and for those that have the children that are essential workers, those are the ones that are still able to be going to school for childcare reasons and a few others decided by the Emergency Preparedness Committee and the school district in collaboration to this issue that we're having. So I hope everybody has got the answers that they're looking for, and that this webinar has alleviated a lot of the stress and concerns that has been going on over these past few days, and that we can get through this together. So thank you everybody for joining.
Thanks for that, Anthony. So just before I call on President Clayton and Nisga'a for their closing, I just wanted to quickly share everything that the committee does in relation to COVID-19 is posted to the NLG website. You'll note that there's been updates provided periodically since March on the nation's response, and you'll see that the restart plan is there as well, or that may be school districts, but ours is also on the website. The nation's is also on the website, and certainly this webinar has been recorded, so and will be edited to be made widely available on the website as well. So if you know of any family or friends that did not have the opportunity to attend this afternoon, then you can let them know that they will be available on the website. And our Q&A, I understand from our tech support that we have the ability to produce a report from the Q&A dialogue in the dialogue box there as well. So once we make that into a presentable form, we'll also make that available on our website. So with that, Madam President, I'll welcome you forward again for your closing remarks.
Thank you. Thank you to all who have participated and attended this webinar. Once again, thank you to the Emergency Preparedness Committee, the medical professionals, as well as Nisga'a Valley Health Authority and School District 92 and all of our villages who do a lot of the work to continue to keep us safe in our homelands. I want to assure our citizens that we will, and as Bobby has pointed out, on the website of the Nisga'a Nation, you will find more information about COVID. But certainly down the road, I'm sure the committee will take a look at another town hall meeting as the as the needs arise. But I want to encourage each of you to stay informed about the COVID-19 in the Nass Valley. I also want to agree with the chair of the Emergency Preparedness Committee, Anthony Moore, to be very respectful on social media of the people who put themselves out there to inform you about their state with COVID-19. I ask, and I want to second that we be really respectful, that we reach out to see what we can do from afar. I encourage each of you to stay vigilant because we are in this together. And Nisga'a government is taking this very serious, because when you take a look at the numbers that were just released today, it's very serious. It was at what yesterday? It wasn't at 8 yesterday. So the numbers are changing. I think we need to be keeping ourselves informed and keeping ourselves safe. So thank you all for participating. Take care and be safe. Thank you.
Thanks, Madam President. With that, that concludes our program this afternoon. We opened with a word of prayer, so I'd once again like to welcome Samagit Keh, if you would be so kind as to close us in a word of prayer, and any additional closing remarks you may have.
Hasaga is an Mahani skidded Argach mean, Gant Argach Tony. Anthony, Upskistum Willem, dem de Bruce Skis Krachasens, at Jim Gagadum. Will nearly apping will knee Willem. Great can will met an axe, Siebens can skats. A silgaden, Sack will yet Argach. Tidaach, met Gaspach dem hen. Can wilt. I just wanted to support what our president and what Anthony Moore has brought forward. The respectful manner which our ancestors always applied to what they had to say. We need to be this way to each other. They are looking after us. They are providing us with information so that we can survive through this pandemic. That we will be comfortable in this pandemic, and that we will be able to walk in a normal way as if we weren't going through this pandemic. That's key. We cannot be, I use the word sakh algach. The words we apply when we are disrespectful are cutting. It's like a double-headed axe. You swing it one way, and when it comes back, it might be more severe. So take care. Take care. Trust them. You have to trust them. Otherwise, they're working for nothing. And with Cladem Skadesa, Kamligat Hash, Nagorum Neen, Nom Neen, Amstum Wilsadum Kamais, Amagagot, the Hitkus Watkum and Skim Statekum. Asachava Satkun. Some will nimdi ko law. Yuktapatsiok. Kagadum. Kagaiskut. Kanokis kumra. Stidoiskus. Atagamasip kun. Kan will to mean. Kan buis kumatuveaigun. Tumkan de paskalis raut kun gilo. As la host lipsawangi. Tumkan will. Tum will.
Thank you, everyone, once again. Have a good afternoon. Continue to be safe, respectful, and kind with one another. Take care.